well, we got free healthcare. They're like my work pays for my health insurance and I can go and do whatever I want. I got an MRI yesterday. I went there in the morning and I thought about, maybe I felt a little pain in my neck and they're like, we should do an MRI. And this is a really, in my opinion, not a great decision. Okay. So people say, I don't want to move to the States. I don't want to move to Europe. I don't want to move to anywhere because of the healthcare. I don't want to have to give up my healthcare.
From here, you're saying?
Yeah. And so, and again, I love Canada and I want to stay here and it's the perfect place for me. But there are people who maybe their jobs or whatever are going to lead them to another part of the world, and good for them. I'm excited for you, go enjoy life. But when you make the decision, you're like 30 years old and you're like, well, they don't have healthcare or health insurance is very expensive. Like, you're 30 years old. What do you really need to do about healthcare at this point in time? I get it. If you're retired and all that stuff, you might want to spend 6 months here in case something major happens and you got your, OHIP and everything like that to help you out, right? Or wherever you are in Canada, the provincial insurance. But I mean, a young person right now, that should be that shouldn't even be on the list of why you're making a decision to go.
I guess it depends on, well, it depends. Listen, my wife, a big part of why we can't leave is because she has a medication that she takes that literally saves her life. And I mean, it would bankrupt most people if I had to pay for this, right? Or if anybody had to pay for this. I'm pretty sure it'd bankrupt me if I had to pay for it, because it's like,
of course, people who have this type of situations are going to make that decision. But I would say the average person in their 30s or even 40s, their strain on the healthcare system is pretty limited. And that if you did end up going to a country that didn't have public healthcare system and you had to get maybe private insurance, or you actually just had to pay for it each time, like, I'm pretty sure you should be making up for that in, if you're getting paid in US dollars, if you're going to the States, or if you've got another opportunity, or you're just living a happier life. So anyways,
but how do you pay
my rant today is strictly just, if you plan on leaving the country, please consider all the different things that you want to, all the different changes that you're going to have to face. And healthcare should be, if you don't have any major health issues or expensive prescriptions or procedures or anything like that, healthcare should be low on the list.
Low on the list.
Yeah, you can get private health insurance, if you got something that's like, concerning, or if you just want to have that sort of security, knowing.
But most people don't have the money to throw around for private
you're leaving
care, right?
You're leaving for an opportunity here. Like, the people I'm talking about are a lot of the people. So right now there's a lot of people who are getting tech jobs in the States. Big time. It's a big thing. All these graduates from Waterloo and people who are graduating from these programs, their prospects are in the States, and the people in the companies in the States are like, we want you. And so sometimes I've heard people in their 20s talk about, well, if I go there, we won't have healthcare. I'm like, what? Healthcare? You're 23 years old. Why is that going to be a factor in where you live right now? You may never even go to a hospital over the next 10 years.
I'm pretty sure. Okay. So if you're in that age bracket, right, and you're thinking about having kids, like, I think those medical bills to have a kid will fucking kill you, bankrupt you. You have to sell your house to have your kid, right?
I think that when you're ready to have a kid, you should be able to find a job that has some sort of healthcare package. And a lot of the good jobs in the States do. I mean, most of the people that I've ever talked to, they say they've got healthcare through their work. So when I'm like, well, we got free healthcare, they're like, okay, well, my work pays for my health insurance and I can go and do whatever I want. I got an MRI yesterday. I went there in the morning and I thought about, maybe I felt a little pain in my neck and they're like, we should do an MRI. And I got it done. And I'm like, well, I know somebody waiting 6 months for theirs.
Like, comment, and subscribe if you got anything from one of these clips. And if you want to see some more, press something on the screen here. Boom.
That was good.
That was good. I like that. That was good.